Yes.
Awesome, thanks. I just wanted to make sure. I know we were having a couple of audio issues earlier. Yeah, I'm an actuary, but I promise that even in 10 minutes, hopefully I won't be able to bore you guys to sleep that long. So normally actuaries have that reputation of being snoozers, but let's see if we can get through this. And like we said, I'm going to go through a few slides pretty quickly. So by all means, feel free to ask questions as we're going through. There are no dumb questions when it comes to reform, as everyone probably knows by now, and even ones that have been asked before, it never hurts to have a refresher. So off we go. All right, so just real quickly, like I said, I've only got about 10, 12 slides here, so we'll go through these pretty fast, but I'll give you a couple of updates on what's happened recently, a couple of reminders about some of the fees and forms, reminders about pay or play, a couple of updates about the exchanges, and then certainly at the end or as we go, excuse me, feel free to interrupt with questions. All right, a couple of the effective dates to keep in mind for healthcare reform. Up until now, of course, we've all been working towards October 1st as the opening date of the exchanges. We all know the website was up and running October 1st. There's been a lot of issues with it. Health and Human Services is promising to have those fixed by the end of the month. They're also next week going to release, at least they're scheduled to release next week, the preliminary membership numbers for the month of October. The only word we've gotten from HHS is that they're going to be low, so we're all very curious to see how those go. January 1st, 2014 is definitely the milestone date for reform. That's the date that all citizens should have some sort of qualified health plan, some sort of minimum essential coverage in order to avoid either the individual penalty or they would have had to avoid the employer mandate penalty by January 1st. That, of course, has been delayed to January 1st, 2015. March 31st, 2014 is the end of open enrollment. There is some concern the government may decide to either extend open enrollment or delay the individual mandate. That could have potentially negative results on the premiums, and by negative I mean raise them. If they were to do that, anyone that's worked with underwriters or actuaries before or closely with an insurance company understands that the less you try to control the risk, the weaker the penalty is for not enrollment, the more likely it is that the healthy people will not join the pool. So that's a big concern. Then, of course, January 1st, 2015 is the new date for employer shared responsibility, so-called pay or play, and then the next big date, as we know now, is January 1st, 2018, the Cadillac tax. All right, late breaking news on October 31st. The government likes to release things on holidays. I don't know what the driver is there, but on October 31st, they released long-awaited guidance on FSA plans. And in a nutshell, what the guidance says now is you can replace a grace period feature. A lot of plans use the grace period feature, which allows FSAs to use monies from the prior year up to 2.5 months in the next year. You can now replace that with a rollover feature, and you can roll over up to $500 in your FSA. So that's kind of a big deal. Anyone that's had an HSA fund or rollover HRA understands that employees do enjoy the rollover feature. So that's now part of FSAs, and that is open to plans for 2013 plan year. So if you've got an FSA now, you are allowed to add this feature to it as long as you make the amendment to the plan by the end of the plan year. So once again, this is not a future date. This one is open to plan years now, and the rollover now is $500.
Here's a place I want to jump in, if I could, Edward, on this. A couple of things to be aware of. If you do this, your employees will love it. They won't have to scurry around and spend up their money before the year runs out. But you're virtually going to eliminate your forfeitures going forward. Your forfeitures is what's enabled you to make up for the times that you get burned when an employee spends their annual election and then quits. So be aware that potentially you'll burn up your forfeitures. The second thing that will happen is that probably you'll get more participation in your FSA. That's a good thing because of the FICA savings that you enjoy and not full tax savings your employees enjoy. But with that potential burn that could happen with an employee who spends their annual election and then leaves you and doesn't make that contribution. Just be aware of that and work with your advisor to think through those issues. Back over to you.
Absolutely. Yeah, you know, the timing is a little bit interesting. Anyone that has a 1-1 plan year certainly is going through open enrollment now, or maybe even is approaching the end of it. So I'm sure there are employer groups out there that are scrambling to make sure they account for this for next year, even if they don't do it for 2013. All right, a couple of reminders and updates about the fees and forms, taxes, etc. As everyone knows, we just got through the first round of the PCORI fees. Those were due July 31st of the prior year. The fee will actually go up to $2 next year. So if you have a plan year ending after 10/1/2013, you'll pay $2 for July 31st of next year. So the easy way to remember that is if you're a calendar year plan and you just paid $1 this most recent July 31st, you're going to be liable for $2 per head the next year. Now, $2 still isn't a lot of money, but it is double what the fee was this prior year. So you're going to want to make sure that when you're setting budgets this year and going forward, 2014 and beyond, that you want to make sure you account for the PCORI fee. The insurer fee, if you're a fully insured plan, that should be built into your 2014 premiums already. There's a little bit of confusion about the insurer fee and the reinsurance fee. So I've heard a lot of questions lately about what's the percentage load for that. And the strict answer is it's not a percentage load, it's a dollar amount. You can see on the slide here that for 2014 it's $8 billion. The reason there's confusion is what the insurers are doing is just like they do for premium taxes now at the state level, is they have to make an estimate for those fees and then they put them into the premiums. So you're prepaying the insurer fee, and the same goes for the reinsurance fee if you're fully insured, so that by the end of 2014 when the fees are due, the insurers have already collected the money up front. Reinsurance fee is similar, $63 per person per year for 2014, which equates to $5.25 per person per year, per month. So that's not a small number. Once again, you're going to want to make sure that you account when you're setting your budgets, either whether you're fully insured or self-insured for these fees, because if you were to convert these to a percentage basis, you're talking about anywhere from 3 to 7% on top of a trend added to your rate increase for these fees that are specifically going to help fund the various features of healthcare reform. What you'll probably notice when you get your bills or your renewal packets from your insurer is they're going to call these fees out separately because they don't want to get another black eye to have to pass these along to their customers for something that's out of their control. All right, the next big thing, strictly speaking, the reason the employer mandate was delayed, if you believe the government's explanation, is that they got a lot of feedback from employers that did not understand the reporting requirements. Those are identified as under Internal Revenue Code Section 6055 and 6056. In a nutshell, 6055 is a document that the employers will provide to their employees in order to help them prove to the government that they've had coverage to avoid the individual mandate. And then 6056 is basically the provision that you as the employer are going to more or less report yourself in terms of are you eligible for one of the pay-or-play penalties. So the reporting has been delayed. So instead of the first report being due at the end of 2014, it's going to be due at the end of 2015. They just released guidance a couple weeks ago, maybe about the 1st of September, that said there's going to be IRS Forms 1094 and 1095C. You can see there's a note at the top there. These forms, to the best of my knowledge, have not been fully defined. I don't think there's a template out there yet, but they at least have identified what the form numbers are going to be. So just keep in mind that even though the pay-or-play penalties have been delayed, 1/1/15 is now the target date. It is not clear to us yet if they're going to extend the fiscal year transition relief for non-calendar year plans. So it's a very real possibility that if you are a non-calendar year plan, you're going to need to be in compliance by 1/1/15, which is going to mean that your plan you're beginning in 2014, you're going to want to make sure you're meeting those minimum value and affordable criteria, which leads right into the pay-or-play commentary. Keep in mind there's two rules or two penalties that are in play, and these apply to groups that are 50 plus. A quick reminder that 50 plus in this case means 50 or more full-time employees and full-time equivalents. Well, the full-time equivalent definition basically means you take all your part-timers, all your seasonal and variable hour people, you throw them in a bucket, you add up their hours and you for a given month or for each month, and you divide by 120. That's how you come up with the equivalency. And then, of course, you're measuring that over the course of several months, probably a year. So assuming that you are over 50 and the rules apply, to avoid the non-offer of coverage penalty, $2,000 times number of full-time employees minus 30, you need to make sure you offer to at least 95% of your full-time employees and their dependents under 26, keeping in mind that dependent does not include spouse in this case. And then to avoid the other penalty, the $3,000 penalty, you need to make sure the coverage you offer is at least of minimum value, 60%, which is simply defined as for every dollar you spend, 60 cents needs to be paid by the plan and 40 cents or less by the beneficiary. And then the affordability criteria, which is 9.5% of, technically it is employee household income, but there are the safe harbors involved that allow you to do testing, which is more practical, whether it be using W-2 Box 1 wages, using the federal poverty level standards, or a conversion formula to use rate of pay. Any good faith method probably will be okay as long as you document it. Those are the three that are prescribed by the government. The main takeaway here being that what you want to do is if you intend to treat someone like a full-time employee and you're not sure if they're going to be full-time to begin with, you know, they might be hourly or work variable schedule, you're going to want to make sure you take steps that you're measuring them so that at the end of a measurement period, if they are averaging more than 30 hours a week, which is the definition of full-time employment status, that you're offering them coverage. All right. Hopefully this will be made available to you guys. What we do normally when we do these presentations is we like to throw in a few slides which basically are kind of flowchart in format. And this is our attempt to take the nearly 150-page regulation around pay or play and boil it down to 2 or 3 slides. Hopefully these will be something you can review to help grasp how the flow of determining your penalty exposure is meant to work. And you can see here that if you go from left to right, if you're full-time, if you're 50 or more, you want to make sure you're taking steps to avoid the penalties. The first step is to make sure you're offering coverage. That's a minimum essential coverage to at least 95% of your employees and their dependents. And then if you're doing that, make sure that you're offering coverage that's affordable and of minimum value, and that helps you avoid the $3,000 penalty. Now, keep in mind the trigger for these penalties is if at least one full-time employee goes to the exchange and gets a subsidy, the penalties could be triggered. And getting a subsidy is the key piece there. Someone may not qualify for a subsidy if they are outside of the brackets of federal poverty limits of 100 to 400%, or if they qualify for other coverage such as Medicaid, Medicare, or another type of coverage such as that. So just because you have employees that go to the exchange, that does not necessarily mean you're going to have penalty exposure. The trigger, the main trigger to keep in mind is, did that employee get a subsidy? All right, okay, the exchanges and everything that's going on lately. Certainly there's been a lot of rhetoric and a lot of buzz lately, the last couple months, month and a half since the exchanges have opened. Basically, if you've been following the news and you kind of sifted through all the pundits and what they've been saying, in a nutshell, what's really happened is HHS probably wasn't the optimal agency to be in charge of making sure such a broad undertaking of setting up this sort of shopping experience was implemented seamlessly. And because of that, exactly what you might think happened when they rolled it out on October 1st. It wasn't ready. All the bugs weren't out of it. And now we've got this mess where people aren't even allowed to enroll. So hopefully we'll have it fixed by the end of November. Anyone that's gone through any sort of a major system change knows that that's probably going to be a very difficult task. But just keep in mind that as for now, they're doing everything they can to get the exchange up and running. If you're in a state that has a state-based exchange, you're probably not running into these issues. This is only for the states that have federally facilitated exchanges. All right, this is just a quick handy-dandy slide. You can look at this to get an idea of, depending on what type of group you are, if you're small, large, fully insured, or self-funded, what are the provisions that apply to you, keeping in mind that things like essential benefits and the metallic plans and the deductible caps only apply to small group. If you're large or self-insured, you have a lot more options around what benefits you need to offer and what your potential taxes and fees exposure might be. Also keep in mind if you're self-insured or fully insured, that's going to determine whether or not you are the one that actually pays the fees associated with reform. The reinsurance fee and the PCORI fee have to come out of your own pocket, whereas if you're fully insured, the insurers are paying those for you and they're charging those in your premiums. Okay, how is the marketplace supposed to work? This slide always makes me laugh a little bit because this is the theoretical way it's supposed to work. Obviously, there's a lot of issues now, but basically, the consumer submits their application online, or they could go through the mail or on the phone, and then the marketplace verifies and determines eligibility and subsidy eligibility, and that's really right there. This step in the middle, this is the one that's causing the website the most problems. What has to happen is someone has to create an account in order for the government's database to look them up and determine what their income was, to do some validation that they are a legal citizen, and to determine their subsidy eligibility. And after that, they're allowed to go and comparison shop and figure out what the best plan is for them. But everyone's getting bottlenecked in this middle step, and that's what's really causing the problem. So hopefully, like I said, they'll get that fixed, and then it'll be a lot easier for your employees to enroll. But just keep in mind that you may get a lot of questions about this process, and there are tools out there that can help you as the employer navigate those murky waters. One of the things you might get questions about is what they call the employer coverage tool, which is really, in essence, an application. This is online through healthcare.gov, and if you issued your exchange notification by October 1st, page 2, which was an optional page, had some information about you as the employer that you could choose to provide to the employee at that time, and you can see it there on the employer information box. But for the most part, employers are not required to help their employees fill this out. That does not mean that your employees won't come to you for information about how the exchanges are meant to work. Certainly, if you have a HR staff or the capability to go out to healthcare.gov and do research on exactly how the employer coverage tool is supposed to work, that could help you answer some of those questions or be prepared for them up front. But in essence, just keep in mind that the employer coverage tool is really almost like an application. When the analogy I like to use, it's a lot of paperwork, almost like when you go to the bank to fill out a loan. There's a lot of information out there about your household, your name, your address, your income, Social Security number for everyone that's applying. There's a lot of information about your health status. Even though they don't use it for underwriting, they're still trying to gather information about your lifestyle, about what kind of coverage you have through your employer. So, as rigorous as you have to go through an application process to get a loan from a bank, think of it in those terms, in terms of what the employees or the people trying to enroll on the exchange are going through. The application has been shortened, but it's still multiple pages, a lot of questions, a lot of opportunity for confusion. So as much as you can, if you have an opportunity to go out and print a copy of the employer coverage tool and take a look at it, that might help you in case you get any questions from your employees.
Edward, I'm going to interrupt you here one more time. I think we've run over our time limit. I'm going to kick it back to them with questions. That employee, you will see that again, guys, probably from employees that will print that off, and they'll want you to complete that. So if you would like, we can get you a copy of that so you can give it to your HR department so that they can go ahead and think through how to answer those questions.
Hey, Rob, I think we got a couple more minutes, so Ed's almost, I think, at an end. Ed, if you want to cover the rest of it. I think this is great information, and I think people will stay with us.
Okay.
All right, great. I apologize for talking so fast. I was trying to get through it a little quickly. Next slide here, all this shows is sort of a scale of what you can get your premium cap to be, which determines your subsidy based on your income. It's a handy-dandy little cheat sheet for the employers to keep in case they get a question from someone that might ask them what their potential subsidy might be. Individual penalty transition relief. A lot of people have confusion about the individual mandate penalty. If you are a non-calendar year plan and you had employees that did not enroll with your plan year prior to 1/1/14, they will not be subject to an individual mandate penalty until at least the beginning of your plan year in 2014. So that's something to keep in mind. You know, people that didn't enroll might come to you and ask, hey, do we have a special enrollment period for employer coverage? You don't have to worry about doing anything like that because the employee themselves will not be subject to a penalty until at least the plan year beginning in 2014. And that's it. If we build it, will they come, right? The old Field of Dreams story. We certainly know that there's been a lot of political wrangling the last 3 or 4 years. The website, healthcare.gov, is facing its problems. But hopefully they'll get everything up and running, and whether or not you agree with the tenets of how healthcare reform are meant to work, as of now, it's here to stay. And the more information we can get out, and the more we can understand it, I think the easier it'll be to make employees and people that are self-insured or buying insurance on their own understand what their options are. And that's it. I appreciate it. We can definitely take some Q&A now.
Well, fantastic. So thank you, Ed and Rob, very much. It was a great presentation, and thank you for both your input. We've gotten a few people who've used the chat function. For those of you who came into the call a little bit late, we have everybody's mics. Our phones are, in fact, muted, so please use the chat function located in the bottom right quadrant of your screen. You'll see it there. Just type in a question if you have one. We have a little bit of time. I wanted to make sure to give Ed and Rob as much time as possible, so we're a little light on the Q&A. We'll go through as many as we have. Any we can't get, we will get to Rob and Ed and ask them to answer those questions and get that information to you. And we have had a number of people using the chat function who said, great presentation, great information. So thank you both very much. Em, do you want to throw a question out there?
A question that came in asking if the ACA will actually drive up the cost of insurance.
I'll take that one if you don't mind. Well, there's a couple of different ways to answer that, right? Certainly, if you're an employer group, and let's say you're a sizable employer group, so not a small group, all other things being equal, in essence, the benefits you have to offer haven't changed that much. However, there are those fines and taxes that are associated with the cost of running healthcare reform, and you're going to see those in your premium or in the statement of account you get if you're self-insured. And so certainly your fixed cost or your administrative cost, the administrative cost portion of your premium will go up. There's no way around that. Now, in terms of the underlying cost, one of the things the bill does not really address certainly is anything to help control underlying costs, right? They try to argue that they're using one of the basic tenets of insurance, which is if we can get more people to enroll, more healthy people, then the average cost for everyone will go down, or at least not grow as fast. But that's predicated on the individual mandate being strong enough to encourage the enrollment of healthy people. One of the big concerns that actuaries and other health insurance professionals on the carrier side have is that would this return to what they call a community rating, which basically means you're not underwriting for health risk conditions, plus you're doing other things like taking away gender rating, some other things that help you delineate the risk. There are going to be a lot of people that would generally be younger and healthier that aren't going to get a break for having those categories of health risk, and so they're going to be less incented to stay in the pool. Older, sicker people are going to be more incented because their rates won't be as high, and so most healthcare actuaries that I've spoken to have significant concerns that the average risk of the pool, especially in the individual pool, will go up. And so you've already heard stories probably from some of the renewal increases that people are getting from the carriers that say that because of the increase in benefits to meet the minimum value thresholds, and because of some of the concern over the risk pool, that it's likely that on average rates will go up. But that's not to say that there won't be winners on the individual side as well. There'll be a lot of people who get a break or will have access to coverage that they didn't before, and won't have to worry about being rated up because of a pre-existing condition.
Great, thank you. We have time for just one or two more. So, Em.
Yeah, we have another one. There's been a lot of hearsay that companies will drop their coverage to move workers into the exchanges. Do Do you think that this will be the case?
I'll take that because
yeah, I'll let Rob take that one.
Yeah, I work in the field. We're seeing a lot of activity in the under 50 life market now. The fact that the exchanges aren't working is causing trouble. But on slide 13 of Edward's presentation today, there's some small group reform pieces in there, the deductible cap and the out-of-pocket cap. There's several groups, small groups in particular out there that had deductibles larger than $2,000, had out-of-pockets greater than $6,350. The market reforms, the new taxes, the combination of all of that, we're seeing some 50% rate increases. And employers are just going, I can't do it anymore, I'm out. And some employers are going to give money to their employees, they're going to give raises. Others of them, they're going to send them to the exchange and see what they can get. Now, again, we can't see what they can get yet because we can't get through the exchange. We believe that there's going to be a significant number of small groups that are going to want brokers like us to coordinate enrollment of their employees into the exchange. We plan to provide that service. We're not recommending it. We're not encouraging it, but it's a fact of life. So, yes, it's going to put a crimp in the health insurance market, we believe. How great, we don't know. Large employers, for the most part, are not wanting to walk away, or we're not seeing them do that yet. But we'll see how the trend goes.
Okay, great. Thank you, Rob. And lastly, we've gotten a lot of requests asking if these slides will be made available, and yes, they will. So,
with your approval, gentlemen, right?
Yeah, that's okay.
Yeah, that's fine. Not a problem at all.
Okay, great. So we will email these out in PDF form to all the attendees that are here today. We've kept track of who's on the call.
I think we have a couple more questions, but we're really out of time. And thank you for extending this great, valuable presentation for our members. It is greatly appreciated. With that, we'll conclude this webinar. And gentlemen, again, thank you very much for your participation. PPC members, we hope we know you got great value from this. So with that being said, we will adjourn this particular session. Thank you, everyone.
Thank you very much.
Thank you. We appreciate it.
Thanks.
Bye-bye.